Good afternoon, viewers. Today is another special day of our conference meeting on the topic, the post-COVID effect on our educational system and the way forward. And to join us in this meeting as a guest speaker is Associate Professor of Public Health, Dr. Titilola Obilade. You are welcome, Ma.
Thank you very much.
Can you do a brief introduction of yourself, Ma?
Thank you very
much.
Thank you very much for having me. I'm Titilola Obilade. As I've been introduced, I'm a public health physician, and in addition to that, I have a doctoral degree in instructional design and technology, which helps in part of education, and a master's by God's grace in public health and international law and diplomacy. Thank you.
Thank you, Ma. To go straight to the questions, what are the seeming effects of COVID-19 on educational system of the nations of the world?
Thank you very much. This COVID-19 itself is the name of the disease. The virus is SARS-CoV-2. As we know, the virus was initially introduced in China in December last year. And between December and now, we have had about more than half of the global population on lockdown, and the other half is coming out of lockdown. And of course, we also have more than 13 million people now who have had confirmed cases of this disease. So the global effect of this disease is huge, is to say the very least. It's affected every sphere of life, educational sector, economic sector, and the health sector.
Thank you very much, Ma. To go further, Ma, can we say we have an effective partnership between the government and our educational administrators towards mitigating the effect of COVID-19?
I'm talking, is that Nigeria or globally?
Nigeria,
okay,
as a country.
We do have a partnership. Now, when you talk about effectiveness, I would like to talk about it in graduations. In other words, let's graduate it from step 1 to step 10, and step 10 being the highest. So in terms of those graduations of the effectiveness, I'll say that perhaps we are on maybe step 2 in some cases, but to reach step 10, we are not near it at all. There's plenty of room for improvement in the effectiveness of the partnership between the government and the educational sector.
Thank you very much, Ma. Also, in some quarters, there's this opinion that COVID-19 has advanced the use of educational technologies in our system. What is your take on this, Ma?
Well, that is also true. There is a yes to that, and there is a no to that. And the yes comes that it has advanced technology in those who are the elitists, those who already have it, okay? For example, now if you look at it now, the way it is, technology is not cheap, all right? So those who are able to afford it are those who are in the elitist group. Now, the gulf between the haves and have-nots is such that it was there before, but now it has widened, okay? Something I need to let you know, in Nigeria, globally, 1 out of every child, of every 5 children that is out of school is from Nigeria. This was before the COVID era. So you can imagine what it's going to be like after the COVID era. So the people who need the technology and do not have it are those that are from poor resource countries. That's countries from Africa, some parts of Asia. But in Africa, you have those who are the elitists who are schooling abroad and they're here. And so they can communicate online and be able to get all the support overseas because they have the technology. But if you look at the other hand, those who do not have, in fact, there are federal schools that do not actually have the technology, so the students are just there. Although we can also look at those who have been using television, radio, to communicate with their students. But then you also look at the power outage, because this is Nigeria, let's get real, we do have power outages a lot. If we do that, some can afford to have the generator. But even then, it's not everybody that can afford it. So you see, everything has to do with the resource capital of the consumer. So the educational sector, what has happened is that it has created a gulf, and the gulf has been further widened by the educational technology. And of course, a lot of people now who are able to get to 5G, the speed is much faster. But those are not even able to get anything. And so the disparity, the inequality increases, it widens further.
Thank you very much, ma'am. In further of our questions, what do you think will be the major challenge for education and health sector if the government decides to reopen the schools and the citadel of learning at this crucial moment?
I'll just quickly use an analogy. In the game of chess, we have pawns. We have 16 players, the pawns. Those are the most in number, and the idea of the pawn is to go from one end of the board, its own side, to the opponent. Maybe the black pawn go to the white pawn. And when it gets to the very end, it has a power to become a fully vested queen. It has actualized it. Similarly, the children of today, they're the lifeline of Nigeria's future. And so if we put them in to a system in this COVID era right now, what we're doing is that we're playing them as pawns that can be captured by the virus before they actualize their own dreams, their own lives of becoming a queen or doing whatever God has put in them to do. So what I'm saying now is it is not the right time, but we need to have some measurable parameters. You know what I'm saying measurable, and by measurable I mean that you look at the reproduction number. The reproduction number is a dimensionless number, and what that does is that it is able to tell us the effectiveness of the healthcare system, and it's also able to tell us how many people one infected person will infect. Let me explain that again. If the reproduction number is 6, for example, that means one infected person will infect at least 6 people. And it's desirable for the reproduction number denoted by R to be less than 1. But let's look at it here. Let's do the math. The first case indexes in Nigeria was like 27th of February. It took about a month, almost 2, before we had 100 cases. Now between May and June, in May we had about 8,000 cases. And by June we are looking at 30,000. That's an increase of 300% of confirmed cases. So that means that virus, the infectiousness of it is rapid, as in is exponentially increasing. It's infecting several people. If within a month it has increased by 300%. So it's a huge number. And so to put the children in such an atmosphere is a high risk, playing them as pawns in the balance.
Thank you, Mar. I want to ask again, what are the guidelines and the rules you think the government and the stakeholders in educational sector should consider before reopening the schools and our citadel of learning, if all this effect of COVID will be mitigated in order not to affect the children who wants to go to school?
Well, we have to work in tandem with one another. We'll look at what we call systems, okay? The federal government itself is a system. And the federal government does not work in isolation. It works with other systems. But the federal government is what I will call the supra system, which is it's inside the federal government. You now have all these other systems inside. The federal government can say open, it can say close, and they do that. So the federal government will work with the ministries of education, with the schools, both private and public, with the universities. But what the federal government has to do first is to bring down the reproduction number. So in other words, while we are having a 300% increase in infectiousness of the disease, we have to bring it down to 1 or at least less than 1 before the environment can be safe. And then we now go to the other systems. The educational sector, the ministries, and the different schools, in collaboration with the federal government, must develop a matrix. And in that matrix, they will have a task and a measurable indicator of what is expected of the outcome of that task. So let us say the students are going to school. Your task is to make sure they wash their hands. What is the measurable indicator? Provision of 2 water tanks for every 1,000 students. So you put that there, okay? Then temperature taking. You have a school of 5,000 pupils, okay? Provision of 10 digital scanners. That is one. So it is measurable, okay? And then social distancing, because really these preventive measures are things that are achievable by our own social, personal, and collective responsibilities. So we have to look at social distancing in the classroom, for example. Are they going to have morning and afternoon classes? Or are they going to have classes Monday to Wednesday for one group? Another group will have Thursday and Friday, and they'll have longer hours? Or are they just going to have maybe the higher classes to come first for the first week, and then the following week the others, and then in between those classes there must be disinfectants? And then before they even start going to school, you have to call the teachers, most especially the cleaners, and retrain them, the cleaners, on cleaning high contact areas. What do I mean? High contact areas: door handles, the toilet handles, places where people pass. They must be cleaned frequently, okay? And then we must have user-friendly information passed on in the assemblies every day. And then mask. Again, it must be measurable. You can't say children should wear masks. Yes, they can wear masks, but if they get to school and the mask gets ripped off, what do? So there must be a certain number of masks in the school to replace ripped off masks, and the mask must be one. But take note, for some medical conditions, it's not every child, everyone that can wear a mask. There's some medical conditions that will not allow them. So those type of children, they can come to school, but they must remain in the classroom, okay? And then also, waiting, when you're talking about eating, when it's lunchtime, stagger the lunch time so that there is no crowding. Stagger your lunch, your breaks, you stagger it. And then decide, every school have to have their own peculiarities. If they don't want to do morning and afternoon classes, or Monday, Wednesday, and Thursday, Friday, or maybe come one week today, the next class come one following week, maybe they want to have an repurpose a space for more classrooms, because it's very important that the social distance must be there, because more than 200 scientists have found out that the disease is airborne. When I say airborne, the droplet is big, is small. When we talk about the aerosol, the ones that were like 1 meter, those are the big droplets. But the aerosols are lighter, they are smaller, and so they travel longer distances, and the air can project them anywhere. So social distance is minimum, let's say 1.5, 2. So those are the things that they must put in place with measurable indicators. In other words, okay, you can say the space of this classroom must not have more than 15 students. You know, that's measurable. So those are things. So if that matrix is there, before a school can resume, you now check your matrix. Maybe each one has a score. The maximum score is 100, and they've scored 80. So 80 and above, they can say, okay, you're free to open. If they score less than 80, go back to the drawing board, go and check the things you need to do. And you keep doing this and re-evaluating over and over again. So it is possible to open schools, but the things, the preventive measures, best practices must be in place. Social responsibility, personal social responsibility. In other words, the parent knows that this child is not feeling well, has a temperature. Don't bring that child to school. And then another thing that must be on that matrix, if the child has a temperature after coming to school, what is the written protocol of what you're going to do? So there are a lot of things that we can't just say here. It's a lot, it's a whole baggage, but these are just a little bit of pointers that can be used in developing the matrix before the students can go back to school.
Thank you very much, Ma. Associate Professor of Public Health, Dr. Titilola Obilade. It is a great pleasure having you on this platform. We do hope that subsequently, when we call on you for further sharing of your knowledge to the public, you will be available to help us on this platform as you have just rendered your time at this moment. Thank you for coming. We really appreciate you.
You're welcome. Thank you for having me.